going to talk now about an area that is getting more and more attention, which is that of gut health. And with us is registered dietitian Lorraine Maher, who is an expert in the area. She's based in the Blackrock Clinic, where she runs the Gut Health Clinic, and she's also the co-author of the popular book, Gut Feeling. Lorraine, let's kick off with the obvious thing then. What is gut health?
So gut relates to the healthy function of your digestive tract or gastrointestinal tract. And it's a 9-metre long tube, basically from your mouth right down to your rectum. What we don't know is an actual definition of what gut health is, but it's become very popular, as he said, and there's an explosion of research in this area. It's a complex to understand exactly what it is. But to give you an idea, we'll maybe focus on 3 main things when we talk about overall gut health. The first one is the obvious one, is the digestion of food. So you need a healthy gut lining to digest your food, absorb your nutrition, allow it to get into your bloodstream and get other help other bodily functions, and then to be able to excrete the waste from your food. That's the first thing. The second thing I'll mention is the gut microbiome. So people might have heard of this in relation to learning about gut health, and this refers to the trillions of microorganisms or microbes that reside primarily in your gut. They're all over your body. They're on your skin, they're on all your organs, but the majority reside in your large intestine. So these are fascinating, very clever little critters that reside in your body. There's probably somewhere like 40 trillion. And in fact, this is really mind-boggling, but we are more microbial than we are human. So we're probably around 50 to 60% microbial. We've got 40 to 50% human cells in our body. So the whole aspect of the microbes in relation to gut health is that they have a number of jobs to do. And these jobs incorporate in production of vitamins. They produce all HB vitamins. They produce neurotransmitters such as serotonin, noradrenaline. They help maintain a healthy gut lining, and they also indirectly affect our appetite through our gut hormones. So this is to give you a flavour of what they do.
Okay, go back for a minute, because the 40 trillion figure is an easy one to say, but it's an extraordinary number. We are more microbial than we are human. In other words, we have more cells of other beings in us than we have of us.
Exactly. They've got their own inner ecosystem. So there's a whole lot happening inside us. And I think that's why gut health is trendy, mega trend, but it's actually legit. So we're just recognizing the role that they have to play in our body, because they talk to other organs in our body and they have all these roles to play, but there have been the forgotten discovery until recent years, probably in the last 2 decades.
And is it true that everybody's microbiome and everybody's 40 trillion bacteria, microbes, whatever else, are different to everybody else's?
Yes, you've got your own unique microbiome. Everybody does. It's like your own fingerprint. You probably have similarities, probably like 2,000 different strains of bacteria that each person has, but we would have different makeup, as will people. If we compare us to maybe somebody who lived in China, maybe completely different. Us compared to somebody who was a hunter-gatherer in Africa would have completely different microbiome. And
developed from where? Where did the bacteria originally? Sorry, is it bacteria or what's the correct term for them?
So the majority is microbiome, which is a collection of microbes, and the majority are bacteria, but you've also got viruses and fungi as well. So
the origination of that microbiome in each of us, we get it from where?
So you're not born with it, you develop it as you are born. So in natural births, vaginal births, that's when the baby is first introduced to bacteria. So there's differences between natural births and, say, C-sections. So those born via vaginal births have more bacteria, but you also start the development of this via, say, breastfeeding, because you have the food that feeds your bacteria, and by the age of 3 you have mostly developed what is your gut microbiome.
Does that mean that to some extent, particularly if you are, let's say it's a vaginal birth and you are then breastfed, does that mean that you inherit the family's microbiome from the mother? Do you get?
Yep.
And I read a thing, and you can tell me whether or not this is accurate. Is it true that there are components within breast milk that are specially designed to feed the microbiome rather than just feed the baby?
So you've got oligosaccharides, or what we call probiotics, and they're specific to the mother's breast milk. But also the environment is important. So it's not just, it's not just breast milk, it's the environment. Sometimes we have they would say there's more allergies or food intolerances if they've got too much of a clean environment. So that plays a role. Antibiotic use, medication use also plays a role. So it's a number of factors, and all of this is just being elucidated in the research in recent times.
There's a sort of a trendiness to it all now, because hardly an ad goes by that isn't advising us to take something that is probiotic. Or what about probiotics? What about that whole biotic end of nutrition? Yeah. Is it important? Does it make a difference to your gut biome?
Well, it depends. So probiotics are live bacteria, and they have to be given in a certain dose and proven to be effective in a specific condition. So they can come in foods, they can come in pharmaceuticals, they can come in tablet form, and there's a number of different ways you can get probiotics. The research isn't strong enough to say the general population just take a probiotic. And the reason for this is that they tend to be very strain specific. So there's thousands of different strains that you can use. And different people react to the same probiotic differently because of their microbiome. So we know in particular conditions probiotics are helpful. For example, in IBS, maybe in inflammatory bowel disease, colitis, maybe with diarrhea or antibiotic associated diarrhea, but not generally just taking a probiotic off the shelf and thinking it will work. It's kind of like becoming more medicinal in that we know it's strain specific. So you wouldn't take paracetamol to treat your blood pressure, same way as you wouldn't just take a random probiotic to help something in your body. You want to look at the research, you want to see that it's proven, which is really important, and you want to tailor it to your own needs.
And what then about the other things that fit in that, and possibly wrongly, that same category, but people talk about live cultures, they talk about fermented foods. Does that benefit gut health?
So we think it does. We're lacking human trials, but people have been taking fermented foods for hundreds of years, and anecdotally people feel better with it. But what we don't have is just good quality human trials, and that's because they're very difficult to do. Because if you've got different people making batches of kefir in their different kitchens, we don't know they have the similar or exact or live bacterial strains. But I think as a dietitian, I would say that yes, include them in your diet. Foods like definitely for live yogurt, maybe kefir, maybe some kimchi, sauerkraut. All of these foods are very interesting, and they do add live bacteria. They just might not have a probiotic effect. Yeah,
do the live bacteria, I've always wondered, do they survive the journey to make it to where they can live? Because the stomach is a harsh environment.
Yeah, I guess we don't actually know. The most evidence is pointing towards kefir, or kefir, I don't know how you want to best pronounce it, but that seems to be helpful in certain circumstances, maybe with constipation, or maybe people with the bacteria in their gut, in their stomach. So it really depends, but I think if you heat the food, you're going to kill the bacteria, but it doesn't mean it might not have benefits still in the food. So it's an area that I think is being worked on. And
you mentioned a topic that a lot of people will talk about, which is for sufferers, to use a slightly pejorative phrase, it is terrible. IBS, irritable bowel syndrome. How common is it? What is it, and how do you treat it?
Yes, it's very common, unfortunately. So it is defined by abdominal pain, bloating, and a change in your bowel habit. So possibly diarrhea, constipation, or a mix of both. And we see that 60% of people with IBS have a change in their microbiome. So we don't know which is the chicken or the egg, which comes first, but it is an issue. And IBS has been redefined as a dysregulation of the gut-brain axis. So your gut and your brain are talking to each other. So we think it's an overactive gut-brain axis that is the defining feature of IBS. And what this means is they threw out a word called gut hypersensitivity, meaning that the communication between your gut and your brain is overrided, and you feel the perception of pain and bloating more than in somebody who doesn't have this going on in the background. But it's very common. It affects maybe 1 in 10, if not more than that, in an Irish population. And there's, I guess if you did have ongoing symptoms for longer than 3 months, like bloating and pain, change in bowel habit, the first thing to do would be to speak to your GP, because there can be overlapping symptoms with other conditions such as celiac disease or inflammatory bowel disease. So you want to first get the medical attention that you need, and then if it is confirmed as being IBS, then you can look into different strategies to help manage it. Obviously diet is one of the big ones, because a lot of people would associate their diet with worsening gut symptoms. The best place to start would be maybe keep a food and symptom diary, and the common triggers would be things like high-fat foods, a lot of alcohol, a lot of caffeine, irregular, erratic food habits or eating habits, large meals, things like that. So a lot of people, maybe 50% of people, can get relief from following a more sensible dietary pattern. And if that's not working, then there are other more invasive or more restrictive diets that can be used under the support of a dietitian. But because of this gut-brain dysregulation, there's a lot more evidence coming out from the behavioural side of things as well. So this would be things like cognitive behavioural therapy with a psychologist, or maybe gut-directed hypnotherapy, yoga, mindfulness meditation.
Gut-directed hypnotherapy?
So this isn't woo, and it's not really hypnosis, it's just guided imagery to help, I guess, in a way, help your body to relax. And so you can take messaging then, and because it seems to be working on the gut-brain axis, has been shown to be pretty effective.
Can you talk a little bit more about the gut-brain axis? Because up until now, I would have lived a life believing that the two operated entirely independently and happily independent of each other, but that's wrong.
Yeah, you're not alone. They have been considered as being separate, but recently it's really at the cutting edge of research with the gut. And if you've ever acted on a gut instinct or had butterflies in your stomach if you were nervous, then that is what you might not have thought, but that is because of your gut, or what they would call your second brain. And this is 100 million nervous cells within your gut that are connected to your brain via something called the vagus nerve, which is a nerve connecting both of your organs. And not only that, but there's other processes with your immune system, with your endocrine system, so things like big words like neurotransmitters and hormones and bacterial metabolites, all interacting in a complex way to communicate between each other. So your brain is talking to your gut and your gut is talking to your brain.
Yeah, you mentioned earlier on serotonin creation in the gut, which I had always thought was a brain chemical, was about mood control.
Well, it is, but 90% of it is produced in your gut.
So does that mean, therefore, that your mood can impact on your gastrointestinal health and vice versa?
Absolutely, hit the nail on the head. So because of what's being discovered within the gut-brain axis, it can affect your food and your mood, the way you think, and your overall health. It's really fascinating. And if I just take one example, it would be major depressive disorder. So these are people with moderate to severe depression, thinking that there is a dysregulation of the gut-brain axis. So one of the landmark trials was something aptly called the SMILES trial. And this recruited a group of people with moderate to severe depression and randomized them to one of either groups. One group is social support, which we know can help people with depressive symptoms. And the other was to undergo implementing a Mediterranean-style diet with the help of a dietitian. And a Mediterranean-style diet is, the foundation is on more vegetables, fruits, a lot more pulses, nuts and seeds, lesser amount of red meats, processed meats, junk food obviously, more olive oil, omega-3 fats. And the group who followed the Mediterranean style diet, 1/3 of them, 30% of them, were no longer classified as depressed at the end of the study versus 8% in the control group. So for the first time, it really showed that a dietary intervention can impact mood via what we think is the gut-brain axis. In overall health, and what we should eat for a healthy gut, is diversity of plant-based foods. So diet diversity is the new buzzword, but really it's not just vegetables and fruits, it's your whole grains, it's your pulses and beans, it's your nuts and seeds, and you mightn't think of it, but it's your herbs and spices as well. So anything that has a plant component will likely be feeding all the trillions of bacteria in your gut. So because you've got trillions of bacteria, it looks like they all like different kind of foods. So the more diversity of plant-based foods you give them, the more likely the beneficial ones will thrive.
So is it a fair extrapolation then that if you're limited in your range of foods, or if you're particularly limited in plant, you end up starving bacteria,
Quite possibly, that is theoretical as well, and some people are losing strains of bacteria. So a westernized diet, obviously, a diet that's higher in processed foods, higher in salt, higher in sugar, higher in fat, higher in additives, obviously will have a worse impact on the profile of bacteria than one versus a majority of a plant-based diet.
And then taking what you said before, you in some instances you could see an extrapolation where that would impact on mood and attitude and how well somebody feels psychologically.
Yes. So that's what's been shown in the most recent research. So it's food and mood are definitely connected. It's not the full story, but it definitely is part of it.
So one of the things I suspect we should check is when people hear the phrase plant-based diet, does that get translated into being vegetarianism? What exactly is plant-based dietary?
Yeah, it can be confusing actually, but it doesn't mean that you have to be vegan or vegetarian. It's just that the majority of foods in your diet are plant-based foods. So this American Gut Project looked at people's microbiota, so it's all the bacteria, and their diet. And they had people who were omnivores, ate meat, people who were vegetarian and vegan, and there was no difference in the diversity of microbiomes based on whether they ate meat or not, basically, but it just depended on the diversity of plant-based foods. So that's the key. Plant-based foods are majority, and meat has a smaller portion, but you can take it if that's how you're inclined to want to eat.
According to the research, there is no advantage to either. You can have a perfectly healthy gut biome while eating meat.
Exactly.
The extremes of something like IBS will obviously be an easy one for somebody to recognize if they have a problem and seek medical attention. Is there any way to tell if you have a just generally unhealthy gut, if it isn't doing as well as it should be?
Yeah, I guess you might have an inkling, but the gut symptoms would be the biggest giveaway. So a lot of bloating, pain, gas, change in bowel habit, that goes on, not just a temporary bout of bloating, we all get that, but if it's consistent and chronic, literally if it continues for more than 3 months, that's kind of like a defining time to go, I must get this checked out. If you unintentionally lose weight, so maybe there's something wrong with your digestive tract, that you can't regulate your blood glucose, store fat, absorb nutrition, for example. If you've got skin problems, so there's a gut-skin connection as well, and sometimes that can be a factor of an unhealthy gut. Or if you feel that you have a lot of food sensitivities or food intolerances, which I would see primarily in my clinic, but it may be to do with something with regard to your gut.
You mentioned earlier on that this was a new area of science, barely more than 2 decades old. I seem to be involved in it. It's a very interesting area of science.
Absolutely, especially with dietetics, because we've learned so much in the past 10 years of how we can alter the diet based on foods and how we can change bacteria and manage symptoms. So for me, it's a really challenging place to work because of our understanding has so evolved. So we know about IBS, we know how it's redefined, we know kind of the therapies that are effective. And yeah, it's very rewarding to help people figure out how to manage their gut symptoms and improve their quality of life, which is key.
Are there any absolute taboos? Are there food which no human gut should ever be exposed to?
I don't really think of it like that, because as a dietitian, we would just like you to think of food as being inclusive. We're always talk about fruit and vegetables, but I think the diet diversity is a key message. One of the studies showed that 30 different plant-based foods per week helps to obtain this more diversity of good bacteria in your gut. 30 foods per week may sound a little bit overwhelming to some people, but actually that's all your whole grains, all your grains. So whether it's breads, pastas, rice, oats, cereals, all your nuts and seeds. So there's, you can maybe list 5 to 10 of those right on your hand, and you can buy mixed nuts or mixed seeds to bump it up a bit. All your vegetables and fruits, all your pulses and beans and legumes, and your herbs and spices. So over the week, it is actually possible to get 30 different plant-based foods. That seems to be the key message that every scientist, every researcher, every doctor is harping on about, that that's what we would like people to do. Once you do that, you tend to naturally maybe reduce more of the processed foods in your diet.
And are processed foods as disliked by the gut as they are by human health generally?
Yeah, it's definitely a case of the composition. So obviously at times you're going to have something like, I don't know, an ice cream or biscuit or bar chocolate, no big deal, but it's your pattern over long term is the defining feature. So what you do the majority of the time, that will impact your gut.
Is there anything, because obviously there's a lot of themes that are emerging in discussions today, is there anything about gut health that is significantly different to just general good nutrition? Because the kind of things that you're talking about variety of plant-based foods, that would seem to be a factor of just good nutrition and diet generally. Is there anything that is separate where you say the gut particularly needs this that the rest of the body doesn't necessarily?
I can't think of anything offhand, but a general gut diet is that diversity of foods, less processed foods, maybe not go too heavy on the booze because that would upset your gut. Looking at your stress levels is really important, managing your stress, managing to your sleep hygiene, so ensuring that you get good sleep, not taking antibiotics or other medications unnecessarily, being active, not yo-yo dieting. Actually, restrictive diets can negatively impact your microbiome, so that could be something that hasn't been talked about before, but that seems to be an important factor as well.
Why the avoidance of antibiotics? Because they can actually harm the...
I guess it's just unnecessarily using antibiotics, so not using them willy-nilly to make sure that sometimes you will need an antibiotic, but just not using them freely.
And the same then is, if I understand this right, the same way as your gut can affect your mood by virtue of the gut-brain axis, the reverse happens. If you're stressed or anything else, you see symptoms in the gut.
Absolutely, and I think the most prevalent way to understand that is to look at IBS. So we know that dietary interventions can be very effective, and as a dietitian, yes, it can be 80% effective. You can help manage symptoms. But some of the trials have used our dietary interventions head-to-head with something like yoga or mindfulness, and both of them have similar outcomes. So both groups get 80% effectiveness. So that's showing you that the gut-brain axis via behavioural therapies can be managed just with that alone. But as a dietitian, I don't think we should go pitting one against the other, but we combine the therapies. And that way people are more, able to follow less restrictive diets, manage their stress, and therefore feel better in terms of their overall gut.
Well, thank you very much for taking the time to walk us through it.
Thank you for having me.